All right, welcome back to your hometown with Brett and Sierra in our medical spotlight today. Hair by Robotics, Dr. Jody Galichia, of course, Dr. Sylvia Doe. Jody, you and I are going to start talking a little bit about this because transplants and hair transplants specifically, back in the day, young man, was not where it is technology-wise today. Let's expand a bit on that.
Oh, we've come a long way. And the thing that got me interested in this was the robot, because that has changed everything. You know, it used to be that they would cut a strip of hair from the back that's about that wide. I mean, enough that it leaves a big scar. And then did you see these early transplants? It looked like cornrows.
Horrible.
I remember once we had a couple of our doctors go somewhere, I think they went to Oklahoma City, to get hair transplants. And they came back and I went, oh my gosh, how do you live with that? So that's kind of what got us very much interested, Denny Ross and I, Dr. Ross and Sylvia, in a better method and higher technology, and boy, the outcomes are good.
Now,
and no strip.
Yeah, right.
Yeah, that's the best part.
Yeah.
Now, Dr. Doe, you've done some of these procedures. Talk about how this is different from that, because obviously we don't want that.
Well, first of all, is the technology. The technology that we use, the robot is so good at picking the right hairs. So the hair in the back, you've probably seen a lot of bald people that have no hair on the top of the head but had quite a bit of hair in the back. It's because that's androgen resistant hair and hair that you do not lose. So that's why you're able to take that hair and put it in the front. So what the robot does is able to pick the best hairs. We don't take a whole section or leave you bald. We're able to change the technology with the robot to pick 1 out of 10 hairs or 1 out of 5, and it picks the best. So we're trying to select the best FEUs that we are able to, because that is actually going to be the success of the transplant. What you're collecting. There's a method of what we do once we the units are collected, and then they get processed under the microscope.
Well, it's fascinating, it really is. And Dr. Galichia, let's talk also, because confidence for men and I, like you and I, in the business world. This is a game changer, and I want you to talk a bit about that, isn't it though?
Well, I think it is. And I think it's so important. And when I look around, I'm like, gosh, I need hair. Half the people I look at, I see just walking around need hair. But it starts at an early age. The first patients that we saw were actually in their 20s. Wow. And then as men get older and they lose their hair, they lose confidence at work, and sometimes with their wife or just with women. They say the man who wants the transplant the most and the quickest and the fastest is a recent divorcee.
That's probably
Sure,
true.
it probably is true.
It's like, I got to get back out there.
You got to get back out there, sure.
That's just kind of a funny thing, but it is true. I mean, people want to look good, and there's more and more emphasis on looking good for men than there used to be. Sure.
So, Dr. Doe, who is eligible to have this procedure, and how long does it take to have it?
Well, anybody. We do the procedure also on women. So when you talk about confidence, I mean, it's a huge confidence breaker for a woman to lose their hair. So we are transplanting your own hair. So certain time of baldness in females are not a good. If you are going bald everywhere, then you're probably not a good candidate. But there's a lot of women that have a lot of hair loss in the hairline, and so those are great candidates to undergo the procedure. For male, really, we want you to get there when you're younger, because then you were able to collect more grafts and be able to place them. If you come with us and your donor side has really starting to lose your donor side, then we're going to have, we're not going to be able to take as much. Plus, there's going to be more area that we're going to have to cover. So we always emphasize that we have to protect the hair you have. So we teach all the things that you have to do, how to maintain your hair, and do the transplant. So it's a combination of maintaining the existing hair to prevent further loss, and then the transplanted. But the transplanted hairs, you don't lose them, so that's the benefit. So the sooner you get, we've had 18, 20-year-olds, 22-year-olds. Wow. I was really surprised how a majority of our clients are very young.
Yeah, just like that, the hair is back.
I know.
Hair by Robotics, statewide, right, guys? You can give you guys a call and reach out and contact, correct?
Absolutely.
Yes, absolutely.
Perfect. Appreciate you being on a medical spotlight very much.
Thank you so much.
Great being here.
All right, we'll be right back.